When you walk into a clinic room, you're never surprised if you see a blood pressure monitor or a stethoscope. Those are things you just expect to be there. And so we think of Alexa in exactly the same way. It's become a really important tool for us to deliver that consistent, reliable, in-the-moment healthcare. In Phoenix, as in much of the US, there just aren't enough doctors and nurses to take care of all the patients. And so we have to find a better way to take care of people tomorrow. And so we're always looking ways that technology can kind of be that future. I was sitting at home having a cup of coffee and I glanced over and there was my Alexa in the corner and it suddenly struck me, that's there all the time.
Alexa.
Alexa.
Alexa. Play some music.
Alexa is a really familiar, ever-present personal assistant and companion. People know it, and Alexa is always there, ready to help and make our lives more convenient. I think that's where you start. And then you start to think about all the different use cases in the clinical environment. Alexa Smart Properties is the Alexa you know and love, deployed in a hospital setting to help improve the patient experience or make the lives of care team members better.
I love to walk the floors and walk the different divisions to find how they're using Alexa.
We always want those ideas. They come from everywhere. And why wouldn't they come from the patients and the family and their caregivers? They're the ones doing the work every single day.
There's a huge untapped potential with the Alexa devices in the healthcare industry.
When you're in a children's clinic, you have the phone system that you're calling your nurse with. Or you may have a video call system that's on a different tablet or whatnot. Alexa is able to bring both of those tools and others into the same device so that hospitals can minimize the number of devices in the room.
This idea of ambient intelligence that's available and always willing to help us is something I'm very excited about. Alexa is the ability to say, call an interpreter, and 30 seconds later, an interpreter is there, is just what we're looking for. Yes, in the moment, I'm probably helping an interpreter not run around the hospital, which is good for them. But the most important thing is I'm helping all the patients try to get to that end goal of being better sooner. It's hard to measure that, but insurance companies understand it because they know they're not paying for 5 or 6 visits. Families understand it because they're not coming to the hospital over and over again or taking unnecessary medications. So that sense of really trying to communicate and understand each other very, very quickly and get to the root of the problem is where it's all about.
Kids don't always let everybody in, especially those close to them, to everything they're experiencing. The impetus for our suicide prevention program was really born out of necessity. And in a health system as large as ours, we really had to start thinking about scalability first and foremost. And so working with David, he was able to take the ideas that we have as clinicians, the best care that we can do for screening, but more importantly, intervening. He was able to think about from a technological standpoint, how can we get these specialists in every exam room across our enterprise?
So our families schedule an appointment with their provider. As they arrive to the facility, they're presented with some electronic forms that they fill out. They'll then hand this over to their child. Their child then can fill out a questionnaire. Based on that questionnaire, we can determine if they've had a positive finding for any suicidal ideation. So that when they bring them into the room, they're already prepared and ready to bring up the Alexa device and have a mental health therapist who can help walk them through that situation and determine the best course of action from there.
We have a responsibility as a health system to meet kids where they are. But if you're gonna ask them how they are, you better be ready to respond. Before, you could only hire so many people, and to get them from one place to another in time, when time is everything, it's urgent. Telemedicine and having Alexa has really made this program sustainable. It allows us to connect with people at their time of need, and that's everything.
At the end of the day, our mission at the hospital is to make people better.
We could bring Alexa into a room and literally use it for patient entertainment, but then also use it for business case to take better care of our patients. I mean, how cool is that?
Alexa gives us the power of connection. It's a love letter to all kids of Arizona throughout our health system, for sure.